Hi, I'm Les Young with Trailblazer Benefits LLC, and I just exposed my business on BizLinks TV network. Learn more about how to get the most out of your healthcare plan with the least amount of out-of-pocket costs. Coming up on my episode of That's My Biz on BizLinks TV.
That's My Biz is sponsored by Visita Live Site and Constant Contact. Hi everyone, Pamela Alexander, and welcome to another episode of That's My Biz. As always, we aim to please and we bring you these wonderful businesses, nonprofits, and associations that we meet when we're out there networking. We want you to know all about them. We want you to do business with them. So we want to give you all the nitty-gritty about them so that you can know, like, and trust them and do business. You can watch this episode again at www.bizlinks.tv. You can also go to our Facebook page, facebook.com/bizlinkstv, our YouTube channel, youtube.com/bizlinkstv. Make sure that you subscribe so that you can get information of when episodes are released so that you can go ahead and catch them right when they're out there ready for you. You can also hit our Instagram page or at instagram.com/bizlinkstv. Comment, share. We want to just get this word out. We thank you for joining us each and every episode. Today, our guest is Mr. Les Young. Welcome.
Well, thank you, Pamela.
Absolutely. Now, he is just he's such a knowledge in healthcare. He's a healthcare consultant, over 12 years experience in this. But now he's not just one of those folks that kind of get a job and then share the information with you. He is actually state and certified by the federal government as well, bonded by the state, certified by the federal government. He is certified in healthcare reform from the American College. Distinguished Toastmaster as well. So he just has that background to really be able to get the word to you and get it to where you can truly understand it. So now, Les, the first thing I want to talk about, first thing I really want to ask you is, how did you get in? I mean, why healthcare?
Well, healthcare was important to me because I've got 5 kids.
Okay.
And 2 of those kids were born with some very serious illnesses.
Okay.
As a matter of fact, the 3rd child, which is my daughter, she's an adult now, she was born with cystic fibrosis.
Okay.
We didn't know what it was. We didn't know what we were doing wrong. We thought that every time we took her to the hospital, it was as if there was a life-threatening situation. And once they let her back home, or we went back home, well, things seemed to get better. And then there was a situation with my 4th child.
Okay.
Now he's also an adult now. He has juvenile diabetes.
Okay.
So he's dealing with that, and I couldn't understand it. All I could do was work, and try to provide income so that we can continue to exist. And then I came across an opportunity to actually get involved in healthcare and to see just what it is, the benefits that you get, how it works, how much you have to pay, how do you keep from going bankrupt. And so that was an interest to me. So needless to say, it was personal.
Okay.
It was very personal.
Right.
And understanding what you can get out of it, what's your options, how to make the best of a plan was very important to me.
Okay.
And so I began to study.
Wow, love that. So the big thing, of course, as soon as we hear healthcare, the first thing that comes to mind is Affordable Care Act or Obamacare, and not only how to navigate that, but just the requirements around it and everything. Just kind of talk a little bit about that, and who is it really for, and how does it work?
Well, the ACA, which is the Affordable Care Act, labeled Obamacare,
right,
is actually for people who could not afford health care.
Okay.
And before that bill or that law was passed in 2010, we had over 44 million people in this country who couldn't afford health care.
Okay.
Either through pre-existing conditions, or the cost was too high, or there were restrictions that the insurance companies were able to apply to them that made it unaffordable. So with this passing of this law, those cost controls that the insurance companies had in place were removed.
Okay.
And it became a much more fair playing ground for the applicants or the clients, my clients, to get involved with. So what we see now is the development of a skeleton system
Okay.
being closed now with flesh, and it's growing, and it's evolving, and it's
Okay.
becoming something more than it was at the intent.
Okay.
Now, there have been some challenges. I'll admit there have been some challenges, but like anything, just like with Social Security, it was challenged. Just like with Medicare, it was challenged. Well, anytime you bring something that's unfamiliar, we become uncomfortable.
Okay.
And so with this, a lot of folks are very uncomfortable with it. Now, I'm not going to say it's for everyone,
Okay.
that it satisfies everyone.
Okay.
Because, again, it's in its growing and evolving stages. So what we're going to see, I'm assuming over the next few years, are a lot of changes. Costs are going to have to come down because that's the key thing.
Okay.
How can we keep costs down
Right.
and say that it's affordable?
You're so right about that. I know we've even gone through the process, and you hear some people just talk about, I was able to get it for $30 a month. I'm like, okay, that didn't happen to us, but so in the idea that you can get it where it is affordable. When you talk about people who, especially people who are either, laid off and then, they had to go with, what is it called when you leave the company and then you have the health care that's available to you for a period of time after you leave the Cobra, right? That expensive Cobra. So you have that, but now this gives you that a better opportunity and something more affordable than what that provides.
Absolutely, absolutely. Because if you're in that income situation where you qualify anywhere between 100 and 400% of the poverty level.
Okay.
And often if you're laid off, you may find yourself in that situation. You can get subsidized by the government for a health plan
Okay.
for the duration that you are perhaps with less employment, but you have some sort of income to support it.
Okay.
Now, again, currently the requirement for one person is $11,760 for the year 2016. That's going to change, of course, in 2017. But if you have a minimum of income of $11,760, you can actually get subsidies. That's the threshold.
Okay.
Now you can actually go up to about $47,000 in income and get some subsidy. But understand, the closer you are to that poverty level, the bigger the subsidy.
Okay. Okay. So it's a lot.
It's a lot.
So with that, how do people really get more educated in learning how to navigate all this? If they're not at a company that's providing some type of healthcare option or insurance option, where do they go? What are the resources to navigate this?
Well, you do have navigators. You can call the marketplace, and they can walk you through a number of things. There were a number of nonprofit groups that were established that were going out doing grassroots education when the program first began in 2014. You may have heard of that. Some of those groups I'm affiliated with, like Get Enrolled America.
Okay.
They're a nonprofit organization.
Okay.
They actually educate. They would have health fairs at different venues, maybe church events, maybe at some of your local malls, and they would actually have people helping you to understand what your healthcare options are there.
Okay.
I've attended some when we first started, and I saw the process was a little bit convoluted because they didn't understand all of the inner workings of how a plan works, what's going to work best for that person, and you could enroll them, but you couldn't go any further than that. Okay. Now, because I'm licensed, certified, and trained, I know how to take it a step further. Okay. And then I have to ask them. I'm going to ask some questions. Okay. I'm going to dig a little deeper and ask how or what is your particular circumstance, and what resources would you need to make this complete? Okay. Because that's important. Okay. Because if you just get the coverage and you don't know how to use it, and you find it, okay, now the deductible is too high, or the copayment is out, or the doctor that you wanted isn't in the network, those are questions that are going to be a problem for the consumer. Okay. So I provide information on how to understand that, how to get around those things, and just what to do. So call me, and I can give you some answers.
All right. So because he just said call him, please tell everyone how they can call you.
You can call my office number at 1-800-957-1987, or call me directly at 770-255-9596.
And I love this. And to have somebody in a face that you can put to it and somebody that you can contact directly makes such a big difference. Because I know calling the health market, you don't know who you're really talking to, what their interests are. But like you said, so many people don't know what they don't know. So you don't even know the questions to ask.
This is true. This
Yeah.
is true. So typically when I get someone on the phone, and a lot of the things that I do, I'm very mobile. We can do it right over the phone.
Okay.
And I can ask about 7 questions
Mm-hmm.
and determine whether or not it's best for you to go to the marketplace or go off market
Okay.
and get coverage.
Okay.
Whether you are in a position for Medicare
Okay.
or Medicaid.
Okay.
Now those are 2 qualifying plans that exempt you
Okay.
from what we call Obamacare or ACA.
Okay. And I'm going to get into that after the break because that's some very interesting information, and I know there's a lot more to that. The one thing I do want to ask before we go to the break is how do people get help in even paying for all this? Because now, well, let me back up. My real question is around in talking about the ACA, the requirements of it. Because in understanding that it came about to help people who couldn't afford the health insurance, but now there's a requirement that if you don't have the health insurance or you don't go with this option, then there are penalties. What are the penalties?
Those penalties are called shared responsibility.
Okay.
So we share in the cost of health care for our fellow Americans. If you don't have the health coverage and you can afford it, but you choose not to buy it because you just don't want what's being offered,
Okay.
then you would pay a penalty. In 2014, it was $95.
Okay.
2015, it went up to $325. In 2016, now it's $695 per adult, and half of that per child
Wow.
in your household.
Wow.
Yes.
So that's for folks that they can afford. Now, so how do they determine? So is the assumption then that if you can't afford it, that you would get it through this? So it's not that you don't want it, it's just that you can't afford it. So then if you're in the scenario of you can't afford it and you just don't want it, then you gotta pay in and help other people.
Correct. That's the shared responsibility.
Okay.
But now let's say that you can't afford it, as
Okay.
you mentioned, then you can get an exemption.
Interesting.
You can get an exemption.
Okay.
And a lot of folks don't understand that.
Yeah.
They think that, well, if I don't get it, they're going to take my income tax money. Well, it's not necessarily true. You can apply for an exemption.
Interesting. Okay, so it's just all a matter of proving what you are and aren't able to do.
Exactly.
Wow. Okay, see, some tidbits here until y'all take your pens and paper out because we're always going to learn something when you're watching That's My Biz. We're going to take a quick break to thank our sponsors, and then we're going to come back and get more into this. We'll see you in a moment.
Meet Shelley. She can make a Labradoodle look like, well, either one. And she's a marketer. Shelley uses constant contact email to spread the word about her services, whether it's staying in touch with her regular customers or reaching brand new ones. It works for Shelley, and her clients are delighted. Shelley's a marketer, and all it took was constant contact. Try it free.
Visita makes it easier for your business to get paid online. With Visita Live Site, your clients can pay for any service, invoice, or scheduled appointment right from your website, social network profile, or email. You can accept any credit card or PayPal, and funds will be deposited directly to your bank account or PayPal account at no extra charge. Easily add payment options to your site that fit your brand and website design and are fully supported on mobile devices. No technical skills are required.
We're back. We thank once again our sponsors for helping us to keep this show out there and make it available for all of you. We also want to thank you all for continuing to join us, continuing to give us feedback and feedback for our guests, as well as letting us know who else you would like to have on the episode. If you're interested in being sponsored, you can reach out to us at that'smybiz@bizlinks.tv, or even if you're interested in being a guest, you can do that as well at that'smybiz@bizlinks.tv, or go to the website and click on the Be a Guest tab, and you'll get all the information that you need to submit to be a guest. Now, before the break, we were talking with Mr. Les Young. Thank you so much for joining us.
You're welcome.
Absolutely.
Thanks for having me.
Thank you. And so we were talking about the Affordable Care Act, and we were just talking about all about the ins and outs about health insurance and getting the information that you need to be able to navigate these waters. The one thing I want to ask before we move into Medicaid and Medicare is just what are some of the changes in healthcare right now in the healthcare insurance plans?
Some of the changes that people are seeing is probably the rising costs. When we talk about changes, we're talking about pre-existing conditions that they could rule out as not being covered, they are coverable.
Okay.
Even HIV is coverable. Now, we know what an expensive disease that can be.
Right.
And so that's why we're seeing a rise in the healthcare costs. You see, insurance companies are now covering things that they didn't have to cover before.
Okay.
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 So they could use cost controls,
Okay.
such as pre-existing conditions, such as misstatements on an application,
Okay.
to rule these things out, and they wouldn't have to cover them.
Oh, okay.
But now we see that these things are coverable. So
Okay.
in answering your question, what are the changes? The changes are for the better.
Okay.
It's just that how we're going to get these costs under control.
Oh, okay. So now, and then is that cost then going across the board for everyone, or is it just it's higher for people that may have some of these conditions that we're talking
It's
about?
for everyone.
Okay.
That's where that shared responsibility
Okay.
concept comes in.
Okay.
It is spread out evenly. One of the biggest problems that we're seeing, Pamela, is that we don't have enough healthy people
Okay.
engaged in the system.
Okay.
As on the other hand, we have a lot of unhealthy people involved, so that's what's
Okay.
driving the cost up.
Okay.
Because they're seeing more hospitalizations, more chronic diseases, and so this is something that they've got to cover and they've got to pay for. So
Okay.
the costs go up, and then what happens? Well, the premiums
Okay.
have to inevitably go up.
Okay. So now we're also finding that several companies are moving away from being a part of the Affordable Care.
Yes, some companies have decided to pull out of certain areas where they are losing money.
Okay.
Where they are losing money. They're not necessarily saying that they won't serve altogether.
Okay.
Because this is their livelihood.
Okay.
It's probably what they've been doing for the past 80 some odd years.
Okay.
Health coverage. So what they may do is take a step back and see if there's going to be some implementation of changes to get
Okay.
these costs under control.
Okay.
Give them a little bit more of
Okay.
a playing field like they had before,
Okay.
so that they don't have to put out so much money for the expenditures.
Okay. Okay. I tell you this, and this is some great information, and the different thoughts are rolling through my head, as I'm sure they're rolling through your head as well. And I could really get myself down a rabbit hole on some of this. So I'm going to move from this part of the topic, and then I want to get into the Medicaid and the Medicare. First piece is, please explain what's the difference in Medicaid and Medicare.
Medicaid is a state-sponsored, but although it has federal contributions,
Okay.
program.
Okay.
State controls that program.
Okay.
Medicare is a federal program. It's throughout the
okay.
entire country. Okay.
Oh, okay.
So whatever the federal government says for one state applies to all states with Medicare.
Okay.
Whatever Medicaid, it's a state-based, so it's going to vary from state to state.
Okay. Okay. Now, does someone pick whether they want to be a part of Medicaid versus Medicare, or how is it determined who can do what?
Medicaid is determined by income and possibly a chronic illness.
Okay.
It's generally determined by how low your income is versus the poverty level.
Okay.
Medicare, however, is if you are disabled for 24 months
Okay.
and if you're 65 or older.
Oh,
That's how
okay.
you qualify for Medicare.
Okay.
Now, you've paid into the Medicare system. You're
Okay.
paying into it now. I'm paying into it now. So we can actually collect about the same time that we begin Social Security. So
Okay.
those two kind of run in conjunction.
Okay. Okay. So, yeah, I told y'all some great information here. So now tell me how that relates to Affordable Care Act.
Well, again, those are qualifying plans.
Okay.
If you have Medicare or Medicaid, you don't need another qualifying plan that's sponsored by the government.
Okay.
So you are exempt
Okay.
from having a qualified plan. If you don't have Medicare or Medicaid and you are above the poverty level,
Okay.
then you could find yourself in need of a plan, or if you choose not to get the plan,
Okay.
penalized.
Okay. And then that's if you're eligible for
Exactly.
either of those two. If not, you've got to go deal with.
You've got
what you have to
your
deal with
employer
that.
can provide it.
Okay.
It could be a group plan,
Okay.
provided by the employer, or you go and get an individual plan on your own.
Okay.
It's on or off the market.
Okay, so yeah, I hope y'all got that. So now, we talked about the age group around Medicare. Repeat
Correct.
that again for me.
The age group for Medicare begins at 65, unless you have a disability
Okay.
that runs for 24 months, then you would qualify for Medicare.
Medicare,
And you could
okay.
be as young as 5 years old
Okay.
and qualify for Medicare.
Okay, all right. So now, then, and you mentioned with Medicaid, Medicare, and Social Security. Now, which one related to Social? You said we got that at the same time. Which one was federal? Medicare.
Medicare is a federal
Medicare.
program.
Okay. So now with that, if you receive Social Security, are you still eligible to receive based on Medicare or Medicaid?
Absolutely.
Okay.
Absolutely. You can be receiving Social Security and getting Medicare.
Okay. Okay.
As a matter of fact, my son, he's, like, as I mentioned at the start, he's been disabled, considered a juvenile diabetic since he was 2 years old when they
Okay.
discovered it. So he's been on Social Security and Medicare since then.
Okay. Wow. Well, so you never know. You never know a lot of times what's out there, and if you don't know what to ask, then you don't find out the information that you need.
Absolutely. And because of this problem, there are resources and locations that we can go to, and I like to share that. And I like to bring experts in when I'm doing workshops or seminars to help them to understand just what you can do to make life better for you in this 21st century of healthcare reform.
Okay. So tell us about that. So, and how you work with your clients, the different ways that you work with your clients.
Well, I work with individual clients, and I also work with small groups and church groups.
Okay.
Go out and we can present a seminar. We raise awareness, answer questions, and then they come back and with their individual concerns, and we help resolve those.
Okay. Okay. So, and then you mentioned you do workshops. What are the different types of workshops that
So different types of workshops would be maybe a panel.
Okay.
And I'm working on one now, as a matter of fact, where we're going to deal with the physical, the spiritual, and the emotional side of health. Not just how your health care plan benefits and options work, but just how you can engage and understand and get the best out of the plan once you apply some of these strategies that these experts have.
Okay. Now, and what I like about that is because, like you mentioned, so often it stops at get the plan. And then once you get the plan, whoever you're working with, you don't really ever deal with them unless there's some kind of issue. But now that I have it, now what?
Right.
Yeah.
Exactly. So to take it a little further, and that's the logo that we use, we go the extra mile with Trailblazer Benefits.
Okay.
We go a little bit further, and we're looking at some of those questions. We're looking at some of those concerns, and we're calling on your behalf as an advocate with the insurance companies, with the claims departments, trying to get some of these things resolved, whether it's a situation with a drug that's not covered. What do you need to do? Can you appeal it? Can they get it covered if it's medically necessary? And most times it is.
Okay. Okay. So again, having that advocate, and that's part of what sets your company apart from just other companies out there that you may run into that can get you signed up for your insurance.
Absolutely. Absolutely.
Okay, I love it. So everyone, you want to make sure that you reach out to Mr. Les Young so that you can get educated, but then also have that support going beyond that. So tell me, going back to the insurance side of it, because this is a really challenging animal out there. We talked about co-pays and all that. What are some of the basic things that people need to look for, or information that they should look for in picking the best provider?
Best provider or the best cost saving plan? Which one is it?
Well, tell me what the difference is.
So let's look at provider. With providers, you have a network.
Okay.
If it's an HMO, it's a very, very stringent network.
Okay.
So it's guarded.
Okay.
Typically. You must stay in that network. If you go outside of that network, you won't get coverage.
Okay.
The bill is on you. You got to pay it all. Now, if you are talking about the costs, then let's look at co-payments, co-insurances, and deductible.
Okay.
Before these were separated, you would have to pay a co-payment, a co-insurance, and a deductible before they may go in and pay that 80%.
Okay.
Now, your co-payment, your co-insurance, and your deductible go into your maximum out of pocket.
Okay, so now let's break that down a little bit because our audience out here, I know they need this information. So the first one you said, the co-payment.
Right.
Now tell everyone what that is.
Let's look at a co-payment. Let's look at a doctor's visit.
Okay.
Let's say we go to the doctor and we're seeing a primary care physician, and his co-payment cost, according to your insurance plan benefit, is $30. You pay the $30. That goes towards the maximum out of pocket that you have to pay for that year. Now let's assume that maximum out of pocket is, I've seen them as low as $750. That $30 reduces that $750 to $720. Let's say he also orders that you go to get some radiation, not radiation, but to get to the radiologist and get some lab work done.
Okay.
And that, let's say that runs another $250. That $250 is now $280 that's
Okay.
subtracted from your maximum out of pocket. So you
Okay.
see how it's reducing that.
Okay.
Now, 3 months later, you're walking down the street, you trip, break your leg, and you gotta call the ambulance to come and get you. The ambulance comes and gets you. By the time you get into the ambulance, that's about $600 to $1,200. And I know this for a fact
Okay.
because a friend of mine, he is a paramedic.
Okay.
So in Metro
Okay.
Atlanta, it's around $600 to $1,200.
Okay.
After that, you go through the emergency room doors, that's another $1,200. So now we're looking at 6 to 12, that's 18,
Okay.
plus what they're going to charge you once you get in.
Right.
You probably have met
Okay.
your deductible
And there's
your
co-pays
maximum out
around
of pocket.
that, right? So there's co-pays for all of that. No.
You once you pay that,
Okay.
once you pay that,
Okay. Because
you've
of
met
the maximum.
your maximum
Okay.
out of pocket. The illustration I gave was $750.
Okay.
From the time that you get into that ambulance, you've met your maximum out of pocket. If your deductible or your maximum out of pocket is that low.
Okay.
And I've seen some plans where we've been able to help people to get them where
Okay.
they've been that low.
Okay, because the current concern there, of course, is that's something that's unplanned, and it's how much money you're going to have to be able to spend at the time that happens, and what are you going to have to come out of pocket with versus how much the split is with the insurance.
Right. Sometimes they refer to it as the exposure that you
Okay.
have. So how much exposure would you have if something catastrophic were to happen?
Okay.
If you had to go into the hospital, let's say that bill turned out to be $150,000, but your cutoff for the year, maximum out of pocket, is, let's say it's $5,000 or even $6,000. You pay the $6,000 and you're done.
Okay.
And if you have another recurring visit to the hospital, you don't have to meet another deductible. It's covered at 100%.
Okay.
That's the difference between the way plans work today and the way they were working prior to 2010.
Okay. Again, everyone, this is a lot of information, so we want to make sure that you have the right resources for this. Before I close, the last question I want to ask you about is for small businesses and where all of this fits in for small businesses, especially if they have employees, but just kind of hitting both scenarios. If it's just a small business, just the owners of the small business and where they're required on the insurance side, and then versus if you have employees, how is this is the act helping small businesses that now have employees and provide insurance?
Well, prior to the act, small businesses were actually kept away from having group coverage. They couldn't afford it
Okay.
because they were rated
Right.
out because they didn't have enough people to spread the cost with. Now, if the small business owner wants to provide coverage, he can, but he can do it a couple of different ways.
Okay.
And some of those strategies I recommend is rather than paying for the group plan, where you have maybe only two selections, let the employees go and select them themselves.
Okay.
Give them a maybe $75 a month or $50 a month per diem to apply towards that.
Okay. Okay.
Okay, so you're reducing their costs, you're keeping the employee happy,
Okay.
and you've got something that you can reduce on your bottom line.
Okay.
So it's a win-win.
Okay.
That's one of the strategies that I would recommend. Because if they're under 50 employees, you don't have to provide coverage
Okay.
as a small
Okay.
business owner.
Okay. So with this, and I know there's deadlines around all of this and the Affordable Care Act and when you can get in with Medicaid, Medicare. Talk a little bit. What are the deadlines that people need to know about?
The deadline for this previous year was November 1st
Okay.
to January 31st.
Okay.
Now, in the previous years, they were extending it.
Okay.
Because maybe technical problem, people are on the line waiting. This year, I didn't see much of an extension.
Okay.
Maybe a week. If you were on the line on the 31st at 12 o'clock midnight
Okay.
and you couldn't get through, maybe if they got your name and your number in there, they would extend it for you.
Okay.
Other than that, it was cut off.
Okay. Wow. So now what about, is it the same deadlines for Medicaid and Medicare?
No, with Medicare and Medicaid, that's an entirely different
Okay.
situation. That's open year-round.
Okay.
Because
All right.
you may qualify at any given time.
Okay.
But open enrollment for Affordable Care Act,
Okay.
for, I take that back, Medicare. Medicare does have an open enrollment period
Okay.
that applies to the population in general. Now, that's between October 1st
Okay.
and December 7th for Medicare.
Okay.
Okay, just to
Okay,
stay
got
on,
that.
stay on, stay on
Okay.
point with that one. Now, if someone were to turn 65,
Mm-hmm.
they don't have to wait until October
Okay.
1st because they have to have coverage.
Mm-hmm.
So if they were turned 65 in June,
Okay.
well, they can get coverage in June.
Okay. Okay.
Okay, because now they qualify for it at the age of 65.
Okay. So now with that, if they were under a healthcare plan, so if I got a healthcare plan, I'm 64, and then I turned 65, say in June, I'm able to switch over?
Absolutely. Absolutely.
Okay.
And that's what I'm always looking out for. I have to check to see, okay, you're really near 65.
Okay.
And these are some clients that I have.
Mm-hmm.
We need to take you off the Affordable Care Act. And I know you were getting it really cheap.
Okay.
But now it's time. We got to obey the law. We've got to switch you over to Medicare.
Okay. Wow. So, and there's so many of you all out there, and we have a vast audience from younger folks to and millennials to the older generation, I guess, and then baby boomers as well. Which I'll put y'all in the older generation, I guess. I don't know. I'm not gonna get caught up in all that. What's older? Just older than the millennials. But so with that, so many people out there to reach out to. What's really your target, or who are the ones that should really be contacting you based on your strong suit and kind of your sweet spot?
I typically cater to those between the ages of 50 and 64.
Okay.
I don't turn anyone away,
Okay.
but that's
Okay.
typically the demographics and the age range that I look for. It's
Okay.
50 to 64 because they need a lot of help. They're moving towards retirement.
Mm-hmm.
They're trying to get Social Security. They're trying to understand these, and I've got expertise in both areas, so I lend it there.
Okay, fantastic. So to everyone, if you fall in that age group, you definitely want to make sure that you reach out to Les. And even if you don't reach out, because I'm sure he can help you, and if he can't, he has the resources and the information and knowledge to share with you to help you with what you need so that you can make sure that you are covered. And that's so that you're paying what's most affordable to you, and you're not overpaying into what you need to pay for there. Les, I thank you so much for joining us today. All this wonderful information. We know you're going to have to go back, listen to this again, and take your notes. Before we go, please, one more time, tell everyone how they can get in touch with you.
You get in touch with me at 1-800-957-1987 or my personal cell where you can get me 24/7 at 770-255-9596 or my website at www.trailblazerbenefits.com, info@trailblazerbenefits.com.
Great. Thank you so much for joining us, Les.
Well, thank you for having me. I appreciate it. I had a blast.
Good. We're glad you did. We want to make sure we deliver on what we promise,
Well,
right?
you
Everyone, you can watch this episode again at www.bizlinks.tv. Make sure that you go back, listen to it, take your notes, and get this information. You know some other folks out there. We've had all these conversations with other people. Share it with them as well. They've been trying to figure out how to navigate these waters. Make sure that you let them know this episode is available to them. And then make sure you write down Les's information and get in touch with him as well. We want to make sure that you stay protected out there like you need to. Go to our Facebook page at facebook.com. Also go to our YouTube channel, youtube.com, and our Instagram. We're BizLinks TV on all of those, so we're real easy to find. Make sure that you share, make sure that you like, make sure that you subscribe. I'm Pamela Alexander with BizLinks TV Network on location, exposing your business to the world.